In the kingdom of Endocrinia, sometimes a villager would arrive at the royal clinic in the grip of a sugar storm, symptomatic or severe hyperglycemia. The royal doctors sprang into action, using their wisdom to choose the best treatment for each unique case. The first clues: assessing the villager. If the villager had classic symptoms, peeing a lot, polyuria, losing weight, or feeling weak, and their blood sugar was very high, fasting greater than 250 mg per deciliter, random greater than 300 mg per deciliter, or A1C greater than 10%, the doctors knew they faced a serious challenge. The two paths, with or without ketonuria and weight loss. Path 1, ketonuria and or weight loss present, suspect type 1 diabetes. If the villager was lean, losing weight, or had ketones in their urine, the doctors suspected the beta cell guild was gone, type 1 diabetes. Insulin was the potion of choice, no time to waste. They looked for clues: a personal or family history of autoimmune disease, and no family history of type 2 diabetes, made type 1 more likely. Path 2, ketonuria and weight loss absent, type 1 diabetes less likely. If the villager had no ketones and wasn't losing weight, type 1 was less likely. The doctors could use insulin or a GLP-1 receptor agonist, sometimes with metformin, if tolerated. If the villager refused injections, a high-dose sulfonylurea was an alternative. Metformin alone wasn't enough at first, but could be added and increased slowly. Considering comorbidities, the royal ledger. If the villager had heart or kidney troubles, the doctors chose medicines with proven benefits for the heart and kidneys, like GLP-1 receptor agonists and SGLT2 inhibitors. But these benefits weren't proven in villagers who'd never taken diabetes medicine before or who didn't have severe kidney problems. If the villager had no heart or kidney disease. If A1C was very high, greater than 9 to 10%, the doctors started with insulin or a GLP-1 receptor agonist. If weight loss was important, GLP-1 was a good choice. If A1C was less than or equal to 9%, there were many options: insulin, GLP-1 receptor agonists, sulfonylureas, SGLT2 inhibitors, DPP-4 inhibitors, repaglinide, or pioglitazone. Choosing the right potion. If the villager wanted to lose weight, GLP-1 receptor agonists or SGLT2 inhibitors were best. If they wanted to avoid weight changes, DPP-4 inhibitors were a good choice. With careful assessment and wise selection of potions, the royal doctors of Endocrinia could calm the sugar storm, restore balance, and help each villager on their journey to health.